If you enjoy psychology content, subscribe to Psychology in Minutes for more. Have you ever opened your laptop to answer one email, then somehow ended up watching videos, reorganizing your desk, checking your phone, and wondering where the last 2 hours went? Or maybe you've interrupted someone mid-sentence, not because you were rude, but because the thought felt like it would disappear if you didn't say it immediately. For most people, that happens occasionally. For someone with ADHD, that's everyday life. Movies like Everything Everywhere All at Once beautifully capture the racing, interconnected, constantly shifting nature of an ADHD mind. Thoughts move quickly, attention jumps, and everything can feel important all at once. Today, we're diving deep into ADHD, what it really is, why it happens, how it affects daily life, and one question nearly everyone asks: if people with ADHD can hyper-focus for hours on things they enjoy, why can't they focus on things they need to do? The answer lies in motivation, dopamine, and executive function. ADHD is a neurodevelopmental disorder that affects attention regulation, impulse control, emotional regulation, and executive functioning. It is not a lack of intelligence, it is not laziness, and it is certainly not a lack of effort. The ADHD brain struggles with regulating attention, not paying attention altogether. This is why someone may spend 6 hours researching an obscure hobby, but find it nearly impossible to reply to a 2-minute email. Common symptoms include distractibility, forgetfulness, chronic procrastination, difficulty starting tasks, losing items, poor time management, impulsivity, restlessness, and emotional sensitivity. Many adults describe feeling like their brain is running multiple programs simultaneously. For example, you walk into a room and immediately forget why. You start cleaning, then find an old photograph, then spend 20 minutes looking through memories. You intend to pay one bill and somehow end up reorganizing your entire inbox. Emotionally, ADHD can be just as challenging. Many people struggle with frustration, rejection sensitivity, impatience, and feeling overwhelmed by seemingly simple tasks. Small setbacks can feel disproportionately painful. There are 3 main presentations. Predominantly, inattentive type often looks like daydreaming, forgetfulness, disorganization, and losing track of conversations. Hyperactive impulsive type involves fidgeting, excessive talking, interrupting, and difficulty sitting still. Combined type includes both. ADHD is highly genetic. It involves differences in dopamine transmission and the functioning of the prefrontal cortex, the part of the brain responsible for planning, organization, and self-control. The ADHD brain is interest-based, not importance-based. That explains the burning question: tasks that are novel, urgent, challenging, or personally rewarding activate dopamine. Routine tasks often do not. So ADHD isn't about choosing not to focus. It's about the brain struggling to generate enough motivation for low-stimulation activities. Treatment can be life-changing. Stimulant medications like methylphenidate and amphetamines are often highly effective. Non-stimulant options are also available. A psychiatrist can help determine the best medication. Behavioral therapy, especially CBT adapted for ADHD, can teach organization, planning, and emotional regulation. ADHD coaching is also incredibly helpful. Lifestyle changes matter enormously. Regular exercise boosts dopamine naturally. Adequate sleep improves executive functioning. Protein-rich breakfast can support focus. Practical strategies include using timers, breaking tasks into tiny steps, creating visual reminders, keeping essential items in designated places, working alongside another person, known as body doubling. Support from others is crucial. Instead of saying, "Just focus," try, "How can I help you get started?" ADHD isn't a character flaw, it's a differently wired brain. And once understood, that brain can be incredibly creative, resilient, and powerful.